Good evening, everyone. Welcome back to another episode of Mind Split Cafe. Before we get started, I wanted to just kind of give a couple of announcements. As you can tell, we are Mattless tonight. Matt is out traveling with some family. I will actually be traveling next week with some family, so it's his turn. He will be back next week, though. I did just want to let everyone know that tonight's episode will be the last episode for season two. We'll be on a 2 week break, coming back on June 28th for the start of season three. And everyone, as you know, you have a familiar face here, Dr. Foti. Dr. Foti, thanks for coming back. How are you?
I'm good. Honored to be on the season finale, so thank you for having me.
Yeah, man. Well, I know you're doing good. I see those stats on Amazon, man. I'm surprised you didn't have a big old grin when you first came in.
I'm honored. I'm honored by all of this, honestly, and humbled for sure.
Yeah, no kidding, man. I
Yeah.
can't wait to see what more comes of it, and that's kind of why we have you back here tonight is to kind of build off what we last spoke about, talk about your book. I know you have a couple pieces you want to discuss with our listeners, and kind of give them a sneak peek behind the books, behind the pages, behind the scenes, whatever you want to call it. So yeah, you want to say hey to everyone, and let's get going.
Let's do it. Yeah. So, for those who may not have seen the my last episode I was on, my name is Dr. Michael Foti, internal medicine physician by training, and full-time faculty member at the Toro College of Osteopathic Medicine in Middletown, New York. For the last Ugh, I now keeps adding up. So I'm gonna say almost a year now. I've been a pretty passionate advocate on mental health, as Chris knows, and I dealt with mental health pretty severely. I had pretty severe panic disorder and depression after having served on the front lines of COVID, also losing my mom around the same time. And now I've been become a speaker about it and speaking at many different events and the amazing Mind Split Cafe. Honored to be here, of course. and
Yes.
amongst all this, wrote a book about it. Came out quicker than I thought. I thought it was going to be more over the summer, but it came in time for the summer for everyone's summer reading list. It's called Grief: A Doctor's Battle with Anxiety and Depression. So it's a pretty intimate view about my time on the front lines and my mental health struggles.
Yeah, and you want to plug in where our viewers can get a copy of your book?
Yeah, located on Amazon and Barnes and Noble.
Perfect.
Yeah.
Awesome. And we'll put a link up. I'm sure we'll put something somewhere over here, somewhere on the screen. Um,
Thank you.
but yeah, man, I'm excited to have you back. I'm super excited for all the success that your book has had and such its infancy stages at that. So we're super proud of you, man, and
Thank
we're excited to see what else comes from it. I wanted to start off. I know you kind of have your agenda of what you want to talk about and the route you want to go, but I just kind of wanted to ask one thing, and maybe a little invasive, but I'm going to be invasive with myself, so you can kind of feel the same.
you. Yeah.
So growing up, my dad was a doctor. We went to regular doctor visits, things like that. He tried to take me to counseling a couple times for like my ADD, and my parents got divorced at a young age, so like now, I went to counseling here and there, wasn't consistent, wasn't a lot. For the most part, I was taught, and just for clarification, I grew up in the Rio Grande Valley, which is a predominantly Hispanic community. And I'm sure you, as everyone else, know that certain cultures and communities have their way of dealing with mental health. And, a lot of the cultures are, and by no means am I saying anything mean or rude, because that's how I grew up, is this exact way, is dust yourself off, you'll be fine. Like, pull yourself up by your bootstraps, you're good. You don't need to talk to anyone, dust it off. And that's kind of how I grew up through life, and kind of bottling things up, and not expressing my emotions, or expressing that I'm feeling a different way mentally. So I kind of bottled things up, and then moving into going through the divorce, and then going through my dad getting remarried, and having that blended family with two stepbrothers, one the same age, same grade as me, another one that was 4 years younger than me, and my brother in the military. So it was a little weird. um but I bottled all that up, didn't express much emotion about it. Was a child, acted out as in high school, had my fun, did things that I shouldn't. But leading up to my dad being diagnosed with cancer, and ultimately passing, I bottled things up completely, and it imploded on me, just immensely, completely imploded, and just I couldn't bottle it up anymore. And Now I'm on this side of the table when it comes to mental health, and I'm able to talk about things. I'm able to encourage people to talk about things. I find that it helps so much more, and we see the devastating effect of holding it in and what can happen. So my question to you, I know that was very long-winded, but my
Oh.
question to you is, how were you brought up, and were you bottling it in when you first started feeling what you were going through, and everything that made you write that book? When you started feeling that, were you bottling it up? Were you trying to navigate it, or what happened there?
Yeah, yeah, no, I definitely grew up, in a similar type of culture. I'm first generation Italian American, so my parents and grandparents are from Italy, and well, my parents divorced at a very young age as well. I think I was less than a year old, so I never really knew my father. Um, and he actually went back to Italy, and then he actually passed away about 10, 15 years ago. So I really never got to meet him. And yeah, no one really talked about feelings or anything like that, me growing up. I mean, it wasn't something we really talked about. My mom was very she was very much on the surface. She didn't, get too deep with that stuff. You know what I mean?
Yeah.
And that was and my grandparents were always everything's fine type of thing. And so yeah, and then so when I dealt with my mental health struggles, I think that was just very much ingrained in me, to just kind of bottle it in and not
Push it down as much as you can.
100%, 100%, and it must have just been ingrained. And the other thing that, you know, I was supposed to be taking care of my family, and because I was dealing with my mental health and having to take a medical leave from my job, I couldn't, and I was ashamed because of that too. But bottling it up and pushing it down, like you're saying, was the worst thing I could have ever done, because if you don't process these emotions, if you don't deal with it and sit with them, it's detrimental to your health, and there's no health without mental health, right? As you know, so
Yeah.
yeah, no, I totally resonate with that.
Yeah, no, I completely agree, and it's crazy how to look at it back then, and now how I look at things. It's just completely polar opposite.
Yeah, yeah, I think we're talking about things more though now, which is great.
Absolutely. Mental health has become a very hot word. It's a hot topic. A lot of people are talking about it. A lot of people are starting to understand that it is something to talk about, and it's okay not to be okay. Essentially, that's pretty much the premise of what we're trying to do here.
100%.
So let's dive into your book. What do you got for us? I'm excited, man. What
Yeah, I'm gonna give you a couple excerpts if you're okay with it.
Yeah, bring it on. Let's go. I'm excited.
Yeah, yeah. So the first one is from the more one of the very vivid patient experiences. So I'll read a part of it. This is something that, this particular part of this chapter, I've been so humbled and honored by people reading my book and requesting it and whatnot. And um uh this one part of this chapter is the one that people always come to me about. I actually just posted something today from someone who, Dr. Gina Anderson, who's phenomenal. She read my book, and this was the one part of the page. And I was interested because I was like, so many people keep bringing this page up to me. So anyway, I'm going to read this part. This will be the first one. So, um, later that day, I sat at the nurse's station discussing our patients with my attending physician, Dr. Riley. Suddenly, a feeling of despair came over me. I sat watching as Mr. Jones was being wheeled down the hallway towards the ICU. In his typical fashion, sitting up smiling, he yells to me, "Hey, Doc, I can't even get up to go to the bathroom? What's all this fuss about?" I could see his usual smiling grin through the now large oxygen mask covering his face. His laughter became less and less audible as he was slowly wheeled down the hallway towards the ICU. The day had become that much darker. A few days had gone by, and with each morning I hoped to see Mr. Jones return to my patient list. That meant he'd be out of the ICU in a much better place for sure. Yet each morning my eyes quickly scanned the list, and again each time his name was nowhere to be found. More days flew by through the chaos, and still no Mr. Jones. Finally, following one of our morning rounds, my attending Dr. Riley approached me with that all too common emotionless stare. "Hey, so I just heard. Mr. Jones didn't make it out of the ICU." Indeed, while Mr. Jones had never left the ICU, a piece of me never left it either. My soul felt shattered.
Wow. It kind of that hits deep for sure. Um,
Yeah.
First of all, I know it was I was smiling while you were reading it, not because of what you were reading, but the way your words came out, the way your words were printed. Very well written, very well
Huh.
worded.
Thank you.
Um, that's why I was sitting there smiling, not because of what you were reading, but how it was read very well. I just want to say that, give it your flowers first, as Matt says. Matt's not here to say that, so I'm going to say it for him. Giving you
Okay.
your flowers, man. That's very well worded.
Thank you.
Um, but yeah, so now back to it. Talk to us. Tell us what was going through your head. Why was that so significant in your life at that point? What's going through your head at that point?
Yeah, so I mean, this is one the reason this is one of the patient stories that sticks with me because I had so many patients, but this one
Yeah,
was one of the ones that stuck with me because you wouldn't know this gentleman had COVID if you saw him. He was such in good spirits. He was just trying to get out of the hospital. You know, I don't talk about it in the book, but his wife had been in the hospital the week prior, in the same hospital, and was discharged. So she just wanted her husband to come back, and it was just one of my patients that it was such a dark time. You know, I shared this with you with your listeners last time, but it was such a dark time, and he was just someone that cheered us up. You know, he was such a good person. I mean, they were all great people, but it was one of those things where you just thought it was going to be a happy ending, you know, because he was so cheerful and positive, and sometimes that really gets you through illness.
absolutely.
So, yeah, you know, and so the fact that it turned so quickly and he never, you know, never made it out was it just stunned me. I just thought honestly, and I talk about it in the chapter earlier on, I said, you know, this must have been, you know, maybe he'll just go there, get stabilized and come out because you know, when the patients had really severe COVID, any movement would drop their oxygen. And it was just sometimes you just had to stabilize them by just having them kind of just chill, lay
Just
down
sit there.
and let the oxygen come back up, you know? And so that's what I thought was going to happen. And so it just struck me because of that and just the whole, I don't know, it's almost like a scene out of a movie. My attending, I can picture it right now, Chris, like my attending coming into the nurse's station. I'm sitting there. He mentions him and I'm thinking that he's getting transferred out. I gotta go see him. You know, I'm gonna go see him because he's gonna become my patient, you know, so that's like just normal protocol. And for him to say that, you know, when I say my soul felt shattered, it was for him and it was for his wife who was waiting for him out, you know, on the outside of the hospital.
Yeah.
So it just wrecked me.
Yeah, I could imagine, man. You know, you being on the front lines, I'm sure you saw it all. I'm sure you saw the death, the successes. You saw it all, front to end. You saw it, and I'm sure you saw a whole lot more of the grim than anyone wants to even believe.
Yeah.
Especially being in New York. I mean, that was kind of I know it was more so New York City, but still, it was kind of the epicenter for a little bit. It was kind of rowdy out there. And why I'm saying this is because I luckily I didn't experience too much death on the COVID front. I had one person, which granted he was like my second dad. Rolando Sanchez, he's definitely like a second dad to me. He was the only one that I actually experienced passing during that time. That was relatively close within my family or circle.
Yeah.
I was in Philadelphia at the time, so there was just nothing I could do to go to the funeral, and there I think there was only allowed like so many people in the funeral at the time. Um,
Yeah.
but I'm saying this because me not seeing any death, relatively any death, just kind of seeing the news and what was going on, it was hard for me to see it too. It was just like, geez, like how long is this going on? It gave me somewhat of anxiety. I'm not trying to take anything saying like I had anxiety like you did or
Mhm.
anything, but it,
No.
it was weird to sit there and see this unfold and unsettling at the very least, unsettling. So you being 100% closer, 100% more embedded in the chaos, um, and even having this one happen to you, how do I put this? How did you start to figure out that this was affecting you mentally? Because at first, I'm sure you were just like, "Oh, what is this? I feel weird. Like I don't feel good." And then all of a sudden, you were like, "Oh, this is because of anxiety, or this is because of this." When did that hit you? How far into the stretch did that start hitting you?
Yeah, it took months, honestly, because at first I just thought, you know, I couldn't live up to being a doctor. You know, I just thought that was what it was, that it was, which didn't make sense because I had been a doctor for, you know, 3 years prior in the worst pandemic. There was no reason why you know, I couldn't just work in a primary care. You know, I mean, I had seen the worst of the worst, but that's what I was chalking it up to. And then it wasn't until the worst times in my life where I was really dealing with very severe mental illness and my depression was really bad and you know I had basically the worst panic attack of my life, which is that next part I'm going to read to you,
Yeah.
that's when I really realized, well, this, and a psychiatrist helped me realize that, which I'll share. That's when I realized, okay, this isn't just a job. Like there was a lot of things I didn't process here. And that's when I figured it out. So it took 4 or 5 months before I really figured that out.
Yeah, I can imagine. I think that again, going back to how things used to be, where mental health wasn't really a topic, it was just
Yeah,
there. We kind of knew it was about it.
right.
At least me growing up, I kind of thought mental health was for more so for the medication,
Yeah,
which like medication management for ADD, things like that.
yeah.
Um, but yeah, I mean, I'm sorry, I forgot where I was going with that. I'm
No,
still
no.
in shock with that first part that you read.
Hmm.
That blows my mind, man. It breaks my heart just to hear it. But go ahead and read that second one.
Oh,
I'll formulate that question back again.
no, 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 yeah. So it revolves around what we were just talking about. So um let's get to that real quick. Yeah. So um it's right here. Okay. So here we are. Okay. Eventually, I knew if not for me, but for my wife and son, I needed to get help. So I did. I began seeing a psychologist weekly, and my primary care doctor started me on an antidepressant. My journey of healing finally began. I had witnessed so much suffering and death, and as the psychiatrist had stated, I had not yet processed any of it. My metaphorical cup had spilt over, so to speak. I had not taken care of the most important person I needed to take care of, me. I, for so long, ignored my own mental health for the sake of caring for those around me, only to the detriment of my own well-being. And I just want to back up to this other part that talks about it. Albeit begrudgingly, I requested to speak to a psychiatrist and was later diagnosed with anxiety and depression. The psychiatrist sat by my bedside and with a very revealing was a very revealing conversation. Michael, why are you surprised? Look at all that you've shared with me. Look at all that you have gone through in the past 3 years. You haven't processed any of the grief that you've experienced, both the loss of your patients and your mom. That is what has led you to this. That is what has shattered your confidence, and understandably so. She was right. My all-time low. I was so ashamed of myself. I was supposed to be a doctor. How could I let this happen? Why was I so weak? The following week, it came to a point where each and every day I would lie alone in the dark in my basement, shuttered away from my wife and son. Daddy, Daddy. His cries buried me lower than I ever felt. I was shamed to be me more than ever.
Man, that's powerful. So
Yeah.
the talk to us. What was going on through your head in that part of it? That last part was very powerful, by the way. The entire the little cert was very powerful, but that last part was great.
Yeah.
Talk to us about it.
Yeah, I mean, that was really my low point that I mentioned. I mean, that when I had that really severe panic disorder, I went to the emergency room and, they did a ton of workup and it was all fine. My heart was okay. And that's when I had to look myself in the face really and say, this is not obviously your heart, which I knew, but this is not just your job. I mean, there's more to this. And like, I had a very long, I mean, I couldn't go into all the detail here, but I had a
Mhm.
very long conversation with that psychiatrist, which I really appreciated. I felt like she spent a lot of time with me that I
Yeah,
was surprised that she did. And she really just sat next to my bed. I'm laying there in the emergency room and we just talked and talked and talked. She just let me share. And when I started sharing about everything that had gone on, one, it was the first time that I had shared about it, and that had been years since it was like, yeah, it was like 2, 3 years since I experienced it. I hadn't shared it about it, and just sharing about it, reliving those experiences, speaking with her, is then when I realized there's more to this. Yeah, I never thought I would suffer from anxiety and depression. It's not something I always felt myself to be a little bit anxious, but not actually as like having an anxiety and depression as a
to where
disorder.
it starts debilitating you in some form.
Yeah, yeah. And once I started going over everything I had dealt with during the COVID pandemic, everything with my mom and the grief that I experienced and not being able to truly grieve her loss, that is when I realized there was more to this that I had not processed. Then to that second part, which I read first, but um, once I started seeing the psychologist, is when I was finally able to deal with these emotions. So the psychiatrist in the emergency room helped me realize there's something going on here. And then I went and dealt with it and really could process what I had experienced. And it was the best thing I could have ever done.
I am so glad you said that last part because you pretty much answered my next question, and I'll just start off by again saying I'm gonna get invasive, so by all means, you don't have to answer this if you don't want to. But
Please, please, yeah.
you're on the medical side of healthcare, regardless. You're on the medicine side of it. I see more of the talk therapy side of mental health. And I've been through mental health to where I've had to have medication management, to where I've had a medication coupled with a talk therapy. And that is the gold standard of what this medication works good, but if you couple it with talk therapy, it's the gold standard. That's how they process it. So I know that seems to be the case with a lot of psychotropic medications, a lot of antidepressants, a lot of um, medications to get you off substance abuse, like Suboxone or Sublocade. They usually typically have you in some form of talk therapy, and I find that talk therapy alone just it allows me to let my emotions out to someone that's not, unbiased to the entire situation. So that alone helps me. um, but with you, I know you said you started taking some medication. You pretty much just said that you went through some talk therapy because you were able to start processing thing. But is that what you did? You go to like an actual therapist and you sat down, you did like CBT or like some sort of motivational interviewing? And how did you feel when you, because I'm telling you right now, when I started going through some sort of talk therapy, and I'll tell you it was cognitive behavioral is the technique that they were using.
Mhm.
I realized stuff about my life that I never even thought of before. I was like, are you serious? So, I mean,
Yeah.
has that helped you beyond with what you just started going for? I'm sure the passing of your mother and your crippling anxiety with the COVID and being involved with that. So that was your initial chief complaint, I'm assuming. So has that helped you outside of your chief complaint?
Yeah, and that's what I went through as well was cognitive behavioral therapy with my psychologist, in addition to the antidepressant that I was started on. And yeah, it was truly a revealing experience. Doing an hour a week every week and really sitting there learning the root cause of the emotions I was dealing with and the anxiety and the panic and the depression, like the root cause of it, and how to really not just process what I'd gone through, process the emotions. Obviously, that was a very important part. But what I learned too in the cognitive behavioral therapy was how to how to get not a get through per se, but just I guess every time it came back to how to handle it. I was given tools. That's
Yeah,
what I was looking for.
that's exactly what it is. It's tools. It gives you
Yeah.
it explain or it kind of allows you to point out what your triggers quote unquote are and
Yes.
when they come, how they come, and what you typically did when they come and what you can do when they come now.
Yes. Yeah,
So
for my
I love it. I think it's probably one of the best modalities out there.
yes.
Um, and I'll ask you some more questions on the book, and we'll get back to that. But I just
Yeah.
now that we're talking about different modalities, this is kind of my favorite part to talk about stuff like this. So
Yeah.
I'll give you an example, and this is just going to be a little funny thing, but so in substance abuse, this type of modality is never used just because it's like in my eyes. I mean, it's used, but in my eyes, I find it to be kind of dangerous. Exposure therapy.
Mm,
So you have an alcoholic, they get off the alcoholic, they go through their detox. Now they're in talk therapy. Exposure therapy is to slowly place them in the environment that they drank in. So the bar that they always went to, just slowly put them in there, and it helps them get rid of those triggers. So it's no longer a trigger. If you're a dope fiend and you're driving down the same street that your dope man lived at, and you're clean and you're driving down that street, you're going to get some sort of nostalgia and possibly relapse. I mean, it's noted that it's high rate of relapse. But so I find exposure therapy, and I try to find my words carefully. That's why I keep stopping, is because I'm not trying to talk bad about it at all. I just find it like I would be scared to do exposure therapy. So the reason I'm bringing this up is, what would you do if your therapist said, "Let's do exposure therapy with this COVID and your anxiety," and they put you in like a chaos, like some sort of situation like that to come over? How would you feel about that?
Well,
just for fun, shits and giggles.
it's funny you say that. My therapist actually, or psychologist rather, actually employed exposure therapy with me. Now,
Awesome.
I was working in an outpatient facility at the time, so there's no way to get me into that type of hospital chaos environment. But I was developing my panic at work, being in the outpatient office. Now, it wasn't because of the job, it was because of everything else. I had basically destroyed my confidence because I hadn't dealt with all of these things, right? So after we had several sessions, she said, go, not on the day of, because I had taken a medical leave. So she just said, one day just go drive to that office and see what happens. Maybe first time drive by it. Then the next time drive, park, and then leave. And that, you know what I mean? So it was like this. And what I realized is that I had zero anxiety when I would drive there. And the reason being is because I had done the homework and
Mhm.
realized it wasn't the job. It was everything else that I hadn't dealt with. It proved to me that it wasn't the job. It was all this other stuff that I just hadn't processed. And that's so it did work in that. Now, again, it's a different context because you were talking about
See,
substance use. So
yes.
that's
So see,
different.
that's exactly why I brought it up, because I felt that the exposure therapy for something that you were going through would actually, I feel like, and I'm not a therapist or anything. By no means am I giving medical advice or
Yeah.
therapeutic advice, but I'm just
Yeah.
saying I feel like that exposure therapy for what you were going through would actually be extremely beneficial, just because you're getting over your fear. Like that's kind of like getting over your fear of heights. You go up slowly, come back down. Next day, go up a little bit higher, come back
That's right.
down.
That's right.
So that's exactly why I brought it up, is because I thought in the back of my head that that would actually be a pretty decent modality for that type of situation.
Yeah. No, I thought that was great. The tools I was given for my panic were fantastic. And a lot of it was actually recreating the symptoms of my panic and showing myself that I could survive them. So, such as, I would have to breathe through a straw to recreate the shortness of breath. Or,
Oh,
yeah, yeah, it was like,
wow, that's
yeah.
interesting.
Another symptom of my panic was I got a lot of contractions of my body. So what I would have to do is sit down and just contract my whole body for a while and just sit with that. So it was a lot of like basically recreate the symptoms, show yourself you could survive it and handle it, and basically just feel better about like that, like sitting with that, symptom. So when it actually did come on, now
That
so it was interesting.
Yeah, no kidding. That's actually really cool.
Yeah, yeah.
I'm gonna have to try and do some experimenting on my own there. I'm gonna
It
try this.
I know that it's the combination of the two. I know the
Yeah,
medication plus the seeing my psychologist and all the tools she gave me. What she told me to do for depression was spend time doing something that makes you, feel present and really have a lot of joy, and that was with my family. So I hadn't been doing that. So I did. Actually was present with my children, with my wife, and it really made me feel so much whole. And I think that was really important. I think that plus the medication, it's now it's interesting. I'll see a situation that would have otherwise caused me panic before, and I'll see it's almost like an outer body experience, man.
yeah,
I'm
you
telling you.
see it coming.
Yeah, and I'll see like, oh, I know where my mind would have went with that, and now
Yeah,
I don't go down that rabbit hole. And now that's how I know I'm in such a better place. Now, I titled the book Grief because I am still grieving, but
absolutely.
I am in a much better place to empower others to get the
To
help
help.
that I initially didn't get.
Yeah, yeah, and just to go back on what you said about you're still grieving. My dad passed in 2017 on Thanksgiving night, and I am still grieving myself. I didn't get to grieve properly when I was going through my little mental breakdown, but now I've been able to grieve properly. I'm at peace with it. I talk to him still. He's just like, I talk about funny things that happen, just kind of for my sake.
Yeah,
And I'm able to grieve, and people ask me like, hey, that was a big deal, like, how'd you take it? It's
yeah,
like, look, it never gets easier, it never goes away, the pain never ever goes away. You just find ways to cope with it, and then those ways don't work at points, and then you just find a different way to cope with it. And I'm not trying to be like sad or anything, but that's just the truth. I mean,
oh yeah.
death is the most common thing that we're going to experience in life, other than like breathing air and taxes. Maybe like death happens all the time, and
I-
it's unfortunate.
I've actually now, after seeing it, I'm going to tell you about this. I've actually now looked at grief in a positive light. And I'll tell you why. I don't know if you've seen this video of Andrew Garfield. He was on a talk show. He's one of the Spider-Men. He's
Yeah.
the second Spider-Man. Um, so If you haven't seen this, I encourage you to watch it. But his mom passed away, and they were talking about it. You can see him getting choked up about it, but he said that he's going to grieve for the rest of his life, and he hopes to, because grief, he says, is all of the unexpressed love for that person.
Huh. That's a good way of looking at it.
Yeah. And I found it such a beautiful thing. I encourage anyone who hasn't seen that to watch that, especially someone who's lost someone,
W-
because think about why we grieve, because we love the person,
Yeah.
right? So you got to like, yes, I wish my mother was here every day, but the fact that I had that relationship, that I had a mom that I love so much, and that's why I grieve her loss. In essence, yes, it's sad, but like you mentioned, but it is in another way a beautiful thing because I wouldn't be grieving her loss if I didn't love her so much, right? So you're holding on
100.
to sadness, but you're holding on to love, right?
Yeah, absolutely. That never really thought of it that way, and I mean, it's 100% true because that's what you sit there and cry about is like you're never gonna see him again, or the good times you had with them. That time we played basketball and he made me like, it's always about the good times.
Yeah.
So that absolutely makes sense. And can you for one more time for the listeners and for our editors back in the back office so we can put it on the screen? What was that? What was the name of that?
Oh yeah, it was Andrew Garfield. He was on a talk show talking about unexpressed love being grief.
Okay. Yeah,
Yeah,
what we'll do is we'll try and find like a link to it and we'll throw it up on our post too so the viewers can check that out. I think that would be a good one for everyone to listen to.
definitely, definitely.
Yeah, and I'm gonna say, man, I've had a phenomenal time on this episode. We're coming short a little bit over time. I still want to ask you a few questions if you still have some time.
Yes.
Cool. So first, I just want to backtrack again to the exposure therapy. I just want to reiterate, I was not talking bad about it in any way. I want to throw that out there because sometimes some people might catch part of it and then not catch the other part and be like, oh, he was talking bad. Just want to throw that out there. I think all modalities help. It's not a one size fits all. So you're going to have to pick and choose what works for the person in front of you. So I'm not talking bad about any of them. But having said that, you got anything else on your book? Do you want to read anything else? Any other little pieces, or we can just talk about it?
One
I got a
short,
couple other questions, but
yeah,
go ahead and read what you got, and then I'll throw those questions at you.
yes, one short segment if you don't mind. It's shorter than the others, and then we could talk. I'd love to. To end it on a positive light, I'll say.
Okay.
Um, I stand here today on the other side of the very darkest times of my life. I am in an amazing position whereby I can teach and mentor the future physicians of tomorrow. I have the most motivated and appreciative students, and I cannot be happier. I now genuinely enjoy spending time with my family and friends. My wife has her husband back, and my son has his daddy back. We were also most fortunate to recently welcome a baby girl into our little family as well. My life has taken a turn for the better, and it's because I sought and obtained the help I needed. I urge and implore anyone in a similar position to do the same. It is by far the best decision we can ever make for ourselves and for those around us. The stigma of mental health in medicine can only disappear if we continue to seek help, speak up, and share our stories. We must normalize seeking help as a strength and no longer a weakness. Let's be the generation to change the culture of medicine for the better. Let us be the change we need in this world.
That's powerful too. I like that.
Yeah, yeah. It's why I wrote this book. And again, it's yes, it's for healthcare workers, but it's for anyone dealing with mental health. I know what it feels like to suffer in silence, and I know there's others who are suffering in silence because I did, and I know there's many others, and I don't want them to. So I want to reach as many people as I can to empower them to get the help that they need because I know it helped me.
Absolutely. Suffer in silence. That's one of the things I've heard a lot in the recovery world, the mental health world, is recover out loud so for the people that suffer in silence. So that's
100%.
exactly what you're saying right there. You're
I
you're
love that.
speaking up for the people that can't right now. So I like that. That's pretty cool. So, off camera, and the other day we kind of chatted, just so everyone knows that Dr. Foti and I do chat. We're not just screen partners here. We do chat about other things.
Yeah.
But we were talking about something cool that happened, and I won't throw out specifics, but because of your book and the waves that you are making a school of some sorts or an entity, an institution, a social institution. There we go. We'll use my sociology degree. Social institution has reached out to you and asked you a few questions about maybe talking to students or providing something for students as far as like a resource or something. So I know that that has happened, and it kind of seems like all these other doors are opening up for you as far as being in the public eye or being a speaker, because of this book and what you went through. Um, so talk about some of these doors that have opened and how you feel about it, and can you help your students now? Do your students talk to you about this? Like, hey man, hey doc, I have 4 exams coming up and I'm freaking out. Like, what do I do? Do you help them in that sense too? I'm interested to know about this.
Yeah. Well, first and foremost, yeah, I always, my students always come to me, and whether they're we have advisees, right? We're advisors. So whether they're my advisees or not, students come to my office. Now, obviously, I can't act as a clinician for them in terms of mental health, but
Yeah,
I do guide them towards the proper resources. And as you mentioned, yes, when they're stressing about an exam or whatnot, they always come to my office, or just career advice. Yeah, we had a great conversation about that. And as I told Chris, that institution did reach out to me. I was humbled to be called a student wellness expert. I don't know if I call myself that, but I appreciate it. And and as I told Chris, the first resource that I told them for their students was Mind Split Cafe. So I
yes.
will share that and make you get read on that
Thank you.
because because I believe in this wonderful show very much. And so that's just been one of many other things. In the fall, I'm going to be actually a speaker at a wellness convention that's being hosted in at the Sagamore in Lake George, New York. So I'm going to be doing that. But the speaking engagements continue to come in terms of podcasts and whatnot, which has been really phenomenal. I'm also, if for those who may not know, there's an organization called NAMI, or National Alliance on Mental Illness.
Yeah.
And I was recently elected vice president for NAMI in our Orange County, New York. So
Yes.
again, very humbled by all of this, and it's been amazing. Because yes, I'm a faculty member, but I believe in community service and providing, mental health is my passion now, and I'm trying to, that provides resources for our community and events and whatnot that we've been doing. And so, yeah, it's been amazing, and I just hope this continues for the sole fact of what you said, right? Recover out loud so that there's others that don't suffer in silence.
Yeah.
I want to empower others for as long as I can. So that's why I hope this journey continues.
Yeah, I agree, man, and I hope it continues to. And Matt and I talk about that all the time. That what we have going on with Mind Split, we hope it continues because it's not just fun. Because I mean, I get to interact with people all the time. It's fun, it's entertaining, but I honestly believe that we're helping people very, whether it's small, a lot. If it gives someone some joy to listen to Matt make a joke, and I love it. Like it's fun. It makes me happy. So I truly hope I can do this as long as possible.
Well, yeah, and I think you're bringing on such amazing people. I think that's part of it too. You and Matt have an uncanny ability to ask the right questions, and
Thank you.
a wonderful back and forth. Shout out to Dr. Gina Marie Papia. We spoke about this recently. She loved being on the show, and we'll do a little hopeful episode at some point in the future. But
Yeah.
yeah, so you bring on great people. I think you've had amazing guests, and then plus again, you and Matt, I think just asks really just the best questions. So I think that's why this is such a wonderful resource. I'd be proud for any of my students to watch.
Thank you. I truly appreciate that. That means a lot to me. And this has been a passion project of mine for a while. And Matt has helped make it come to life. And I couldn't be happier, man. It's just so much fun. I love being able to meet people like yourself, and like you said, just such great, phenomenal people that have phenomenal experience, and knowledge. It just like I don't even got to go to therapy anymore. I get to talk to these people daily, and it's great. You guys give me tips and tricks all on my own. Like you just gave me a handful of tricks I can use now. I
Thank
love
you.
it.
Thank you. And shout out to Matt. I miss you. I'll see you next time. Just know you were missed.
Oh, thank you. I know he's
Yeah.
gonna see that. He's definitely gonna see that during the Q&A, and he's gonna smile. I know he will.
Good.
So yeah, no, I know we're coming close to time, and I know the viewers. I didn't mention this part, but the viewers, we're about to have Dr. Foti on a roundtable with another one of our prominent guests that have been on a couple times. So this is gonna be a good one. It's gonna be a part of season 3. Can't wait for that one. But Dr. Foti, it has been phenomenal talking to you today. I know we kind of went a little bit longer than normal, but do you have anything else you want to talk about? Anything you want to say about your book? You want to leave our listeners with a little something to the next time?
Yeah, well, one, thanks for having me. It's always a joy being here. Yeah, I would really appreciate anyone really, either who's going through something or knows someone, to pick up a copy of my book. I think leave a review because then it just helps. Honestly, more people know about it, and I'm just trying to get my story out to as many people as I can. So, I'd really appreciate it. And yeah, and until next time, I can't wait.
You know what? Right before we sign off, I just thought of something awesome. Let's do a giveaway with your book right here, right now.
Ah,
I'll take care of the cost. Mind Split will pay for it, and we'll deliver it to the person that wins the giveaway. So, what do you want the giveaway to be? What do the listeners have to email us? So, they got to be following you on
okay,
TikTok, or not on TikTok, sorry, on Instagram. So,
okay.
what's your Instagram? Say that real quick.
Dr. Foti 129.
Okay, so you got to be filing Dr. Foti. You have to be following Mind Split Cafe. And what else? So the way Matt and I have done the giveaways before, we ask a question from something within the episode, so we know that they watched the episode.
Okay.
So, what do we ask them? What do they gotta relay to us?
That's a good. All right. So it's got to be something from the episode.
Yeah.
Um, I would say, um, oof, this is a tough one. Oh my goodness, this is a tough one. Maybe when we were speaking about, okay, what when Chris and I were speaking about, um, different types of psychological therapy and
Okay.
talk therapy. There was one specific one that both Chris and I mentioned when we were getting pretty vulnerable there about that we both did. It's a commonality among both of us.
Good question. Good one. I like that one. All right.
Yeah,
So, what was the modality that we had in common that we both went through and experienced and like?
that's it.
All right. All right, guys, you hear it. Let's get the first person to email us the correct answer and is following both Mindsplit Cafe and Dr. Foti. Go ahead and send the email to info@mindsplit.org. info@mindsplit.org. Good luck, guys. All right, Dr. Foti, I cannot wait to see who wins. I love doing these giveaways. I'm going to tell
Amazing.
you right now, I who I think is going to win is going to be, and I won't say the name, but I'm going to tell you it's a listener from San Antonio, Texas, an avid listener, and he's going to text me when he hears this. But I guarantee you, he's going to win.
Amazing.
Yes.
Cool.
So everyone, thank you for listening, Dr. Foti. Again, thank you for coming back. I can't wait to have you on with the roundtable, and I can't wait to have you on with Dr. P as well. That's going to be awesome. Gina Marie is going to be great. Both of you together.
Yeah.
I think that's going to be great. So thank you very much for showing up, hanging out with me, and even though Matt wasn't here, we had a blast.
Yeah. Thank you so much. I
Yep.
always I always love this.
All right, everyone. We'll see you next Friday. Thank you.